All right, this is the fun part. You have been thinking about your ideas, you have formed teams, you are ready to roll, you are going to do presentations and pitch the judges and make them really excited about your project and give you money. I am going to do an executive summary. Why am I going to do an executive summary? Because everybody's busy, you're busy, your audiences are busy, and that sort of is point number one for the executive summary. Everybody you're talking to is busy. More than 100 people have signed up for the Jefferson Health Hack. I don't know how many teams have formed because I'm recording this in advance, but they have to hear each of these teams and they have to hear the presentations and they are ready to roll. So what we have done is, let's cut right to it. What we have done is create a series of slides that sort of help you run through your presentation. You do not have to do these slides the way they absolutely are and the way they've been given to you, but it's helpful. And the reason it's helpful is over the years, we've seen teams get up and it's scattered and they haven't quite got their act together and and they stumble through. So number one, you will see team name, team number, list team members, and the final slide will have, if you can, photos of your team members, because you're trying to make it. This is sort of tip number two. Not only is your audience busy, they are betting on people. They want to hear from your team as a group of people and bet on you. When people are giving money, many times you'll have a series of ideas, all of which are very good ideas, but which team did it look like people were excited, like they were working together and gave credit to each other? So as it says on the slide, your slides do not need to look like this, but take a moment to identify your team. Then you get into the story. What is the problem? What is the problem that you've set up and the problem you as a group are tackling? Again, these are prompts. Is there a need? Is there a gap? Is there an issue? Who feels this? Who are the people who are being hurt? These are tips that sort of give you a chance to be tell a little bit of a story here. And I'm gonna, after I get out of the executive summary, I'm gonna talk about how to do a story. How did you discover this need? Then your solution. When you do the problem statement, don't do too much of the sort of the old fashioned, there are 500,000 people who suffer from chronic illness of whatever type and blah, blah, blah. Try to present it in personal terms so that when we get to the solutions, we also hear them in personal terms. How would this help someone? Whether it's a device, application, service, product, or expertise, can you demonstrate it? Can you show it? One of the keys to a good presentation is, do I walk away understanding it? They are giving you, they're judging this based on your business model. Are you able to identify ways in which this will actually happen? So one of the things we all know is everybody has a bright idea. You can go into any healthcare setting and see things that should be improved. But how do we know that this is set up to succeed? How do we know that this will move forward, that this will understand the users, the stakeholders, the payers? What do these groups need? What do they want? How does the idea you have and how it's going to work as a business? And then the final slide that we give you is the team name. I've seen teams stumble over this as well. It is actually helpful if you divide, okay, it's time to give your presentation. There are a number of you, say there are 5 of you sitting around and you're getting ready to do your presentation. If you can do a rehearsal, do a rehearsal, but I recommend somebody's the MC, somebody does the introduction, somebody gets this started. Maybe that's not the same person who presents the idea. Maybe a new person presents the idea. Maybe a new person presents the business plan. All of that works. But it helps, what it helps to do is give this sense of a team so that it isn't just one person with one idea. talking for the full time. And then when you get questions, it's helpful if the people who did the product or the people who did the business, if they answer the questions and it doesn't, again, feel like it's only one person. Now, I have seen teams do that, and then they get asked a question and nobody really knows the answer. At that point, the MC, whoever did the introduction, whoever set it up, if you don't know the answer, that's your turn to step in and come up with a bringing it back to message. All right, executive summary, final tip. Elevator speech, you're talking to people who are distracted. They have other people they're judging. They may be running up in an elevator. Be ready to give a story, because people respond to stories. Be ready to give it relatively quickly. And then a couple of other things. You know, it's 2 years of Zoom, and I still see people who sit in a dark room and you can't see them very well. I still see people on Zoom who are yelling at their laptop because their audio is no good. I happen to use these. I know they're distracting to use wired earbuds, but I've found that people can hear me and I can speak in a normal voice. So however you're presenting, however you've set it up, think about audio and video and make sure they're clear, because that's nothing will sell this as a professional presentation than if the audio and video are clear. All right, that's the end of the executive summary. I'm gonna flip at this point to a little longer sort of conversation, a little wider ranging conversation about how you do a story. How you do a story in the real world. Imagine that you are on this stage, virtual or real stage for the hack, and somebody asks you a question that you didn't anticipate. This is what we do with media training when we're talking to people about talking to reporters, for example. I have done this many times in my life. I have been stuck with questions I didn't know the answer to, but I've also gone into interviews where I knew I was going to get asked tough questions. And the thing I do in advance is I do this message box. Why is a message box important? Because no matter what question you're asked, you have to bridge back to your core message. You have to bridge back to the one big thing you want people to remember about you. So the message box works because it's like a story. It creates that sense of, how did we get here? Which is my first question. I want you to start to answer. What are your values? What are the values that drove you to examine this issue? Maybe it's personal experience, but and that's good, because it gives a sense of many of the winners of the health hack in the past have been people who had personal experience with an issue, not necessarily as a patient. They could have been trying to help someone. Then we go into the center, into the middle, and then who agrees? Are there other people who think this is a big problem? Is there other support for it? Is there, you know, here's where you can cite literature review and say, you know, in the literature, we found that this is a significant issue. Then there's the what we did. So in this case, the evidence points are, you know, can you demonstrate the solution that you have? And then the last is where we're going. What would the next steps be? And you see how that became a where we started and where we're going. That's how you sort of write a story about whatever it is that you are presenting. And if you can fill out, the way I do this is I fill out those 4 boxes on the outside before I write the messages in the middle. And the messages in the middle are what you're going to bridge back to. So if the message in the middle is X, then the story allows you to say, how did we get there? Well, our values led us to X. You know, what did we do? We developed the solution because we believe that this addresses X. There are other people who support us in doing what we're doing when we looked at the market, or we may find that there's a gap in the market. That's fine too, to do X. And then where we're going, this idea, this X, is going to go in the following next steps. It just gives you a way to make a story. People, this is a concept called information mapping. People like to follow a story, and the human brain follows a story better than it does disaggregated facts. So if, for example, an information map is a science paper starts with a statement of the problem, a review of literature, what was the experiment we did, what was the methodology, what were the results, and what's the conclusion. In many cases, for a story in real life, you actually start with the conclusion. And you start to tell that story in this, what are the values that got us to the solution that we're proposing? And then sort of assemble around it third parties who believe this is a good thing, or others who think this is a good thing, maybe research you did that supports that this is a good thing. What we did, how we developed it, how we tested it. Again, research can help you there. And then where we're going, how we propose to do a business plan that supports the solution that we have. This allows you to tell a little bit more of a story than just, who, what, where, how, and allows you to sort of draw people in. And again, if at the end of this, one of the judges asks you a question that you didn't anticipate and you're not entirely certain what the answer is, you can use this question, blah, 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 and your brain freezes and you think, I don't know the answer to that. Well, how did we get there? Our values suggested the following, which is why we did what we did. Our research suggested the following. So then you get the opportunity to restate your main message. And that's sort of the longer version of how to create a story. So have fun, be enthusiastic, be passionate, use that emotional side of your brain, because that's the side that people respond to. And that's how people will come to understand the work that you've done during the hack and the solution that you're proposing. And with that, I have not taken a lot of time because you don't have time. Just remember, your audience doesn't have time either. Get to the point, get to the conclusion, get to the main message as fast as possible. Thank you, and have a wonderful time with the Jefferson Health Hack.